going to talk a little bit about how long you should be in counseling for. um, yeah, it's just a question I get a lot, whether it's from clients that I have and or friends or family or people that I meet. Lots of reasons why we ask this question, but just for the purpose of this, of course, I can only speak from my lens, my personal life, my experience in therapy, and then how I navigate this with my clients. And each provider is, of course, going to have their own stance on this, depending on what theories they work from or what modalities they navigate their sessions with. So definitely encourage you to check out with your therapist or your prospective clinician and ask them some questions about this and their view on it, whether it's during your consultation call or before starting sessions, or you've been seeing them for quite some time and you're just interested in hearing how long typically their clients are in session with them. Some providers definitely believe that people should be in therapy forever and others do not, and then anywhere on the spectrum of that. I personally think that everyone should have access to affordable and accessible mental health care whenever they want it, if they do want that. That is under the understanding that I'm also a believer in kind of mental health, self-care all year round, integrated into your day-to-day life. This may mean sometimes that be going to counseling or going to therapy, and that's what the mental health care we need at that time is. But other times it's like seeking community or support groups or connection with something larger than yourself, or being in nature or doing body work or coaching. You know, there's lots of different ways of meeting that kind of like daily or everlasting mental health self-workspace. But specifically for this, we're going to be talking about counseling. Of course, I go to counseling myself and I am a counselor, so I have lots of clients. Specifically talking about counseling, a lot of the work that I do with my clients is getting them to a space where they can like be their own counselor and build them a little bit different internal relationships with themselves. And this will then allow them to sort through like their thoughts and their feelings and their sensations a little bit differently than how they were doing before. So then they're able to connect with them and eventually explore, alone, similar to what we do in session. My goal is to ultimately help those clients, reach a point where they don't need counseling anymore. They, of course, will have personal work to do because we are humans, who doesn't? But they have kind of learned those internal skills again that they can kind of like internally separate from some of those triggered parts and do the work alone. With all this being said, counseling has also taught them to kind of like know their own bodies a little bit more. So how their mind and body, just how their system works. And so let's say we have someone who's been in counseling, they stop coming to counseling, but then they kind of notice like certain signals that their body is sending them and different thought patterns they're having or whatever it may be. They're just noticing like this kind of is getting me back to a space where I feel like tackling this alone is not the best for me to be doing. And so maybe that does mean that those signals that are sent to us with our thoughts and our sensations do land us back in starting counseling services again. But it just, again, kind of depends. But the goal is to be able to know what's going on in our mind and body and meet it with a non-judgmental, curious, and compassionate ear. And know that we're doing what we need to be doing at that moment. And maybe at that moment it looks like starting counseling again, or maybe it looks like I'm doing some other wellness service. But again, just being in a better space to know what our mind and our body is telling us. Okay, so back to the kind of like title of this video is how long do I need to be in counseling for? I definitely hear you being like, just tell me how long is like normal. 1 month, 4 months, 5 years, 10 years. There's really no, answer, direct answer to that. There's no right or wrong path for you or your relationship with counseling, or the length of time that you spend in it. It's really all about like you and your lived experiences, and really being in that open-minded space to exploring without judgment or expectation, for your sessions to go a certain way or to be a certain length. All while knowing that, of course, based on what's going on in your current life, and then based off of kind of that existing internal framework that you've got going on, all of that is going to impact, of course, the length of time that you do spend with your counselor. Also keeping in mind that it's a super subjective experience. So outside of like the actual length of sessions, there's not really a lot that is guaranteed in counseling of like how long you're going to be in it or like what you're going to experience. Super frustrating. But the sooner that we can like kind of notice the parts of us that think therapy should like look a certain way or last a certain amount of time, the more equipped we're going to be to kind of like update those parts of us and just like let them know whatever is happening like in the moment is where we need to be and what we need to be doing right now. So to ease some kind of parts of you that are like, just give me some concrete stuff about counseling. Really the only concrete thing I can give you is like the length of sessions. So personally, like for me, each session is going to be 50 minutes in length. Whether that's an intake session or follow-up appointments. It's pretty typical for therapists to have like a 50-minute hour. Some therapists, of course, do 60-minute sessions, 90-minute sessions, 30-minute sessions. So check in with your provider on those offerings, but that's like kind of the only concrete thing within like length of counseling that I can give you that might appease you. But back to kind of the therapeutic process, of course this varies greatly person to person on like how long you're going to be in therapy for. Many presenting concerns can be dealt with in a brief period of time, but that's not always the case, and unfortunately there's just no magic formula to determine that. So I've got some clients who come like on a weekly basis for like 5 months, some who come like maybe on a bi-weekly basis for like 9 months or so, and then others who come like weekly or bi-weekly for years. So there's really, again, no right or wrong pattern in there. It's just like what's working for you. Typically my clients do start out with like these weekly sessions and then choose to go or change to like bi-weekly or another level of frequency based on what they're wanting to do with our sessions. The reason for starting out with weekly sessions, which is pretty common in the therapy world, is based around consistency and comfortability. So we usually do get to a point in counseling of sharing things with our therapist that possibly we've never shared with anyone before. And in order to do that, there's got to be trust, there's got to be a relationship, and we've got to feel comfortable in that room and in that session. So a lot of what kind of helps is like time spent and consistency spent with that increased exposure to the normalization of having a safe and secure space to share all of our inner thoughts and feelings, again, in this like non-judgmental environment. So if we only go to counseling like once a month, roughly 12 times a year, not all parts of us have really gotten the opportunity to likely feel that safety and to be comfortable and trust that therapeutic relationship and process. So it may be really difficult for us to make progress in the way of learning about ourselves a little bit more. Or we may feel like this resistance, or we kind of keep getting stuck or hitting these like walls or roadblocks. So when thinking about this in terms of like something else other than counseling, so like a wellness activity, sometimes it clicks a little bit better. So if we're wanting to kind of get back into like a running routine for our fitness, going for a jog once a month, we likely, like if we're just going for a jog once a month, we're likely not going to sustain much more distance than we did at the beginning. But if we go for a walk once a week and jog every other week, and we're kind of following a different plan or routine in that way, and we're consistent with it, we are going to give our cardiovascular muscles a lot better of a chance at increasing their stamina by working out those muscles on a more frequent and consistent basis. So of course, no right or wrong way in like tackling that like running physical training for that race, but likely the person who's up and moving more frequently will meet their goals a little bit quicker or in a different way. So translated to therapy, the individual committed to kind of self-growth and healing by prioritizing it and going consistently might be able to accomplish those goals in therapy at a different pace than others who only go once a month, because again, that consistency is building a framework that this is okay to be doing. Where if we don't do it but yet once a month or more infrequent in that way, it's kind of like starting over every time we meet that space where we're feeling a little uncomfortable or whatever it may be. So of course, no estimate of how long you're going to be in therapy for, but reminder, that's really always your choice. I mean, yeah, like it's your choice to enter therapy and it's your choice to stay in therapy. And it's really something that you and your provider should kind of be like openly exploring throughout the services. So during kind of the therapeutic process, I check in with my clients. Your therapist should be checking in with you. You can always bring it up to your therapist as well, but it may be helpful in being able to see kind of like where you started and where you're at now in regards to possibly shining some light on that timeline if there is something inside of you that feels like a ticking clock of like, how much longer am I going to be in therapy for? I really try to do this frequently with my clients just to check on progress towards whatever they're wanting to work on, but also just continually evaluating like their current like want or need for counseling still, because of course that's always going to fluctuate. I'm sure some of you are still listening to this being like, what the fuck, lady? Just give us a straight answer. Tell me how long I'm going to be in therapy for. Yeah, I'm not going to still, and it would be really nice if I could just be like, yep, looks like you got some anxiety going on. You're going to go to services for about 3 months, and then you'll be like good to go and on your way. But that's just not how it works, because typically once we kind of get into that relationship, there are parts of us who want to stay in that relationship with self and want to learn more and do get really curious and do get a lot of relief from the counseling relationship. But just to kind of like wrap things up, I know I'm kind of going on one right now, but just like you'll typically know when it's time to like end or pause therapy services like internally. So when you're able to like openly communicate with yourself and with your provider about your thoughts and your feelings and really exploring all your lived experiences or whatever you're looking to explore, the answer to kind of how long we should be in counseling typically lives inside of us. So we're going to know when it is the right time for us to stop or pause or restart services, allowing counseling to kind of like fit into our lives when we want it or we need it, and knowing that if we do leave it or we press pause, we can always come back, and kind of allowing that flexibility to be in the process to remove some of the pressure that we feel to enter therapy and or to stay in therapy long term. But yeah, I'm sure some of this maybe is helpful and some of it not so much, because again, there's just those parts of us that just want to be like, tell me I'm normal since I've been in therapy since I was 12, or tell me I'm normal that I've been in therapy for 2 months and I'm already over this. All of that's normal. All of that's to be expected. If you have any questions about that or follow-up things, feel free to reach out. If you want to schedule a session with me, of course, feel free to reach out to, and we can do a free consultation. If for whatever reason you're not really looking for me to be your specific counselor or don't have a specific question for me, you can always just reach out and let me know what is going on and kind of how you're looking to pay for services and how you would like to do those services, and I can help you find a provider that kind of meets those needs. But yeah, okay, thanks.